If one were looking on the internet any day of the week, any hour of the day, one of the issues that's really dealt with is penile size. Men always want to have a bigger penis. It's a very common topic, and for many men it's really troublesome. So I'm going to actually ask John Mulhall, please, to address the question. And if we can go to the audience, please, if you want to come up and ask your question for us, I think it is an excellent one.
I had prostate cancer, and I'm proud to say that an implant that you pump up takes about the same time to remove. In at 7 in the morning, up at 2, and out the next day at noon. Your prostate's gone and you're at home. But in the recovery, I found that the penis shrunk and that it actually receded in my body, and that I had to reach in and pull it out. Exercises or whatever at the time I asked about didn't work. What we went to was triple mix or trimix, and I found that by injecting it made the penis, which was about the size of your baby finger, become the size of your thumb when you're totally relaxed, and that it stays outside the body now about an inch, where before it constantly, whenever you go to lift something up or pick something up, you have to go to the bathroom in a hurry. I always found that it receded in your body. Is there any exercises or anything you can do? The triple mix worked to bring it out that far.
So that's an excellent question. This is a very commonly complained of problem. In fact, there is medical evidence to suggest that a significant proportion of men have measurable loss of penile length after radical prostatectomy. In the earliest stages after prostatectomy, it's likely to be a temporary phenomenon. It's likely to be the sensitivity of the nerves and the hypercontraction of the penis into the body. It's likely that's what the situation was in you, because using trimix, and in some men using pills, actually it causes that muscle inside the penis to become more relaxed and for the penis to hang out. However, in men who go long periods of time without erections, some of them are going to have erection tissue damage, and that will lead to permanent loss of penile length. There are two other things that contribute to that. One is some men develop Peyronie's disease after radical prostatectomy, scarring condition, contraction of the scar, they lose penile length. And one of the other things that we see in our patients is that some men put weight on after the radical prostatectomy. They stop their exercise program, they start putting weight on at the lower part of their abdomen, what's called the prepubic fat pad, and this takes perceptual length off the penis. So there are the four factors that contribute to penile length loss. From the standpoint of reversing that, there is a suggestion that perhaps the use of the vacuum device with some regularity may prevent that, or may go some way towards preventing that from occurring. But at this point in time, there's not definitive research done to really answer what the best treatment strategy is for men in your situation.
Thank you. You know, our patient raised a very, very traumatic question, and I applaud his fortitude to ask it. I have been impressed in my practice with Peyronie's disease over the utility of the two stretching tools that are available on the market. And I know one of our panelists, Dr. Levine, has a lot of experience with that device as well. I wonder if you might speculate or perhaps share with us some of your clinical experience, Larry, using penile traction for men who are post-prostatectomy.
Thank you, Greg. My experience with this tool for men after radical prostatectomy is relatively small. We're sort of building a group of patients now, which I hope someday to be able to present at our annual meeting. But currently, I have about 6 men who have lost length already. So we're not using this as a prevention tool, which I think would be worthy of study, but they've already lost length. And all of them were destined to go on to have a prosthesis, a penile implant. They were concerned about their loss of length, and we put them on this this traction therapy on a daily basis for 3 months. So far, the men who've completed that trial have gained up to 2 centimeters, almost an inch of length back. at which point then we could put the prosthesis in and hopefully preserve that length, because the prosthesis will do that. So I'm excited to share with you that this may be another option for the use of this traction therapy to try to maybe prevent, but maybe even regain some of that lost length that occurs from the post-prostatectomy situation.